Maricon, and this is the mental status exam for NUR 3066C. Hello.
Hello.
How are you?
Good.
What's your name?
Carolyn Johnson.
All right, Carolyn. So we'll be doing the mental status exam. First, just from walking in, we notice that the patient posture is relaxed, her body movements are voluntary, deliberate, and coordinated. Her dress is appropriate for setting, season, age, gender, and social group. Her clothing fits and is appropriate. The patient is clean and well groomed. Her hair is neat and clean. She has light makeup and her nails are clean. Clothing is not disheveled. As we can also see, her level of consciousness is alert. She is aware of stimuli from the environment and responds appropriately. So, Carolyn, tell me about yourself.
My name is Carolyn Johnson, and I'm a pilot for JetSuite. I have been flying for 7-8 years now, and I was born in New York. Moved to Miami when I was 3.
Perfect. Can you tell me what you do for fun?
I go to the gym.
Oh, you're one of those. Okay. So, as we can also see, her expression is appropriate and to topic. So, just from what she was telling me, we could tell that her speech quality is effortless, her pace is moderate, and her speech is fluent. Her articulation is clear and understandable. Her word choice is effortless and appropriate to education level. Patient completes thoughts, occasionally pausing to think. So, how do you feel today?
I'm alright.
Just alright?
I could be better. I failed the test recently.
Okay, so you failed the test. So could you put like a word to that feeling? Are you mad? Are you sad? Are you disappointed?
Disappointed.
Disappointed and?
Sad.
Okay. So because the patient said she was sad, we'll do a little extra assessment at the end of this. But for now, we will check her cognitive function. So to test her orientation, we'll ask her 3 questions. So Carolyn, do you know what today is?
Today is Wednesday,
Okay, and the date?
the 24th.
Okay, so it's also important to not pay too much attention to if they don't know the exact date. As long as they know the year, maybe the month, it's okay. Do you know where we are at this moment?
We're at Broward Health Medical Center, the Patient and Family Center.
Yes. So for the purpose of this test, we're at Broward Health Medical Center, Patient and Family Center. Carolyn, can you tell me your name?
Carolyn Johnson.
Okay, I kind of gave her that one. Either way. Next, we'll check her attention span. So for that, we'll do the serial 7 test. Carolyn, from 100, you're going to subtract 7 and keep going until I tell you to stop.
Okay. 100, 93, 86, 79, 32, 65.
Good. Not bad. So that's a good way to check attention span. We're going to check her recent memory by asking her, what time did you get here?
Around 4 o'clock.
4 o'clock. Okay, so that's a pretty good number. She's correct. It's important not to ask her something that you can't verify, like what was the last thing you ate, since you don't really know what she ate last. Another thing we can check is remote memory. So Carolyn, who is the current president?
Trump.
And who was the president before him?
Obama.
And the president before him?
Obama again.
And the president before him?
Bush.
Okay, perfect. So now we're going to check her new learning by asking her 4 random words. By telling her 4 random words and then asking her to repeat them at the end. So Carolyn, your 4 random words are ankle, tulip, table, eyedropper. We'll check that again later. To check her judgment, we'll ask her future plans. So Carolyn, what are your 5-year future plans?
Get promoted and buy a house.
Sounds realistic. We can also see that her thought processes are logical, goal-directed, coherent, and relevant. Her thought content is consistent and logical. So Carolyn, how do people treat you?
Pretty well.
Do people talk about you?
Not to my knowledge.
Okay. Do you feel like you're being watched, followed, or controlled?
No.
Is your imagination active?
I'd say so, yeah.
Have you heard your name when alone?
No.
Okay. So, earlier in the examination, Carolyn said that she was sad. So when patients say they're sad or in despair, we assess for their risk of suicide. So Carolyn, Have you felt that life isn't worth living?
No.
Have you felt so blue that you thought of hurting yourself?
No.
Do you feel like hurting yourself now?
No.
Do you have a plan to hurt yourself?
No.
What would happen if you were dead?
I'd be dead.
How would other people react if you were dead?
Oh, they'd be sad.
Whom could you tell if you felt like killing yourself?
My husband or my sisters.
This concludes the full mental status exam. The next video will have the mini mental status exam and the audit test. Can you name me the four unrelated words I told you earlier?
Ankle, table, tulip, eyedropper.
Perfect.